Indian Medical Association has released a list of 382 doctors across the country who died of coronavirus and has demanded that they should be treated as martyrs and their families should be given compensation. They've also accused the government of indifference towards the doctors and what they call are abandoning national heroes. This comes a day after the centre said that it did not have complete data on the number of healthcare staff who have been affected by and died from coronavirus. Let's bring out some statistics for you now. Now, 4 out of the 382 doctors who died because of the virus and in the line of duty were below the age of 30. The youngest doctor who died of COVID was 24 years old from Haryana. The oldest doctor to die of COVID was 86-year-old from Tamil Nadu. 5 states which have the highest number of doctors that have died of COVID-19 includes Tamil Nadu on the top with 63, Andhra Pradesh 42, Karnataka 42, Gujarat 39, Maharashtra 36 doctors who lost their lives trying to cure others of COVID-19. Sukirti Dwivedi now joins us for more on this. Sukirti, it's a hard-hitting letter coming in from the Indian Medical Association. The government so far has been talking about them constantly. You even had the Prime Minister in several of his Mann Ki Baat talk about, even his national addresses, talk about how he's so proud of his corona warriors. Now these corona warriors saying that they have not been looked after by the government.
Well, yes, Sonal, very strong statements coming from the Indian Medical Association. And what also needs to be noticed is that this association, which comprises doctors from across the country, thousands of doctors from across the country, all of these months, doctors have been working day and night. But the IMA never came out this strongly against the government. They said, yes, we've been getting cooperation from the government. Now PPE supply is getting better to the doctors. And throughout, they were with the government. But now with what they call is indifference from the government saying that we do not have data of the doctors who died from COVID. So all the compensation issues also that could arise, they've washed their hands off that. And to that, the IMA has responded in this manner, saying that on one hand, you call us corona warriors. On the other hand, you deny us the status and all that comes along with being called a martyr, all of those benefits being denied to the families of all of these doctors who died in the line of duty. By doing that, it exposes your hypocrisy. Now, these are the kind of terms they've used for the government, saying that you are abandoning the national heroes. And like you said, the Prime Minister has often made statements saying that our corona warriors need to be supported. We've had these different events also, bang on utensils, light up lamps. We had the Air Force fly past, showering flower petals upon these hospitals across the country. All of that was done. But the IMA now saying, what have you done really for all of those who died in the line of duty, all of these doctors who died? And NDTV also has been reporting constantly on several of these doctors, whether it was a 27-year-old doctor in Delhi who died, or Dr. Asim Gupta, who was in his 50s. He was an ICU anesthesia specialist handling the ICU of Delhi's biggest COVID dedicated hospital. If you look at it, is across age groups that doctors have worked day and night to save so many lives. But now for the government to take the same kind of approach that they took with migrants, saying that we don't have data of deaths, so the issue of compensation does not arise, taking a similar sort of approach with doctors as well. Very strange at this point of time when these have been our frontline warriors that have been at the forefront of really saving so many lives, working even through the hardest of circumstances, even when the country did not have enough safety equipment, even then they were working, even when they did not have enough gloves or PPE kits, they were there, out there working, keeping,
So
sacrificing even the health of their family members.
Are they planning to take this forward?
Well, as of now, they've written this letter and they are hoping that the government would come up with a response. The IMA has not made it very clear on what their strategy is going to be further. But considering it's a strong statement from them, and also let us keep in mind that today Dr. Harshvardhan is set to make a statement in the parliament on the handling of COVID, and we would expect even from our opposition parties to raise this issue in the parliament. Yesterday they had questioned government's handling of COVID and how state governments were not taken on board while several decisions were being taken. So all of that has happened in the Rajya Sabha. The health minister will also be talking today, but remains to be seen whether this is one issue that the health minister may end up addressing or not.